call the Behavioral Health Policy and Funding Committee to order. Amy, would you please call the roll?
Sure. Hannah Eisner.
Here.
Carla Pohl.
Here.
Susan Schaefer.
Here.
Corey Tello.
Here.
And Judy Buchanan.
Here.
All right, so we have a couple items for discussion on the agenda today. One being just for informational purposes, Amy's provided us a copy of the contract that we're proposing to use to enter into with our grantees. So Amy, I don't know if there's any comments you want to make about it, but what I thought is maybe we could each just, if anybody has any questions or comments, we'll just do them one at a time. That way Amy can keep track of what's going on, and maybe we will, by the time it gets to the last person, we'll have covered everything. So Amy, do you want to say anything first?
Just that the service agreement contract, continue to try to evolve it each year to meet to kind of like troubleshoot anything that comes up throughout the year. But we really try to use it as a resource guide or as a reference for the agencies. And so I try to make it as clear and concise. So if there's questions, they can look at it and it's clearly explained in the contract. But yeah, any feedback on any things that you may have noticed that need to be put in there or need to be clarified is more than welcome.
Okay, thanks. So I know we got it in the packet, but I don't know how much time people have had to review it in any detail. I don't know if anybody, I have a couple of questions, comments, so I'll let Judy start and then we can just go around. Go ahead, Judy.
Okay. Amy, I noticed in the contract it refers to the agencies sharing their sustainability plan for the dollars out, for dollars outside of what the Board of Health is funding. Do they? I guess I was reminded of that in terms of what we're looking at this afternoon. What kind of information do you anticipate or do you look for when they give you a sustainability plan for services outside of what we're funding?
So as far as that piece, the main thing that they give us is other funders or the main thing that they give us is funding that they get from other funders or like fee for services as far as like the financial sustainability piece of it. But that's actually something that Lori Walrab on the Mental Health Advisory Board and I are discussing is the sustainability and what that would look like. And so it's hard right now to like ask for something specifically from these agencies on a sustainability plan because they don't really know exactly what that would look like. So it's in there, but it still needs defined. And so that's something that with like the marketing and sustainability goals from the Mental Health Advisory Board. And so we've been talking a lot about marketing, but Lori Walrab and I have met about sustainability, and we're going to meet again in January. I'm sorry, Judy, it doesn't really answer your question because it's.
Well, and it sounds like we've got some work to do, but I was just, I was interested because agency that presents a proposal to us to meet a certain need, and as I said, in this case, we're not going to be able to fund that need. What will that agency be doing to sustain their ability to meet that need with dollars outside of our funding?
Right,
and so it could be written into the contract. We can explain.
Corey, so when Judy's finished.
Yeah, and so also the sustainability, so some of them, like in their applications for this year, for all of them in their applications this year, we asked about their sustainability plans, and some just very, I think actually probably most just said if this funding didn't exist, then the part the Board of Health was funding, then they wouldn't be able to do it, or they would have to cut back on how they're doing it. And so that's one of the pieces that Lori Walrab and I are talking about is if for most of these agencies, like the Board of Health is purchasing a service, if that is not going to be purchased and the agencies are stating, then they're not going to be able to do it. There may not be money from any other place. And so I agree with your comment that there's a lot of work that has to be done on like defining sustainability and the expectations on behalf of the board and what the agencies are able to meet.
Well, and as I said, for example, the case of CHS, they requested, they're looking at serving 600 people, which I'm assuming, maybe I shouldn't do that, that's the need that they anticipate requesting those services or needing those services. And it would look like they're not going to be funded for that. So I'm wondering, where we document the need that isn't being met by the dollars, either we or other sources provide. So
that makes sense. So it's kind of, there's a sustainability piece, but also where are the gaps, even in like the services that are being funded? Are there further gaps? Could there be more that would be served if there was other funding resources or if there was more funding? That makes sense.
yeah, it does. And that's something we've not documented before. We've made some assumptions, but I just wanted to raise that, and maybe we can continue to discuss it another time.
So Corey, I saw your hand up, but I thought, if Judy, do you have any other comments about the contract before we move on?
Thank you. Thanks,
Okay.
Andy.
You want to go ahead, and if you were addressing Judy's point and any comments?
I am about the sustainability. Like, for example, I'm looking at the sustainability response that was in this year's Center for Human Services psychiatric request. And they actually broke down sustainability into community sustainability, financial sustainability, and organizational sustainability. And they talked about how they participate in many efforts, large scale social service coordination, behavioral health. They were answering community sustainability as there is a considerable community support for the psychiatric program, as it's considered a foundational component of the behavioral health system. And they basically just said they'll continue to remain an active participant with all the interrelated community stakeholders that meet regularly, blah, blah, blah. So they're basically saying no matter what, they will continue to be a participant in the big picture. Then their financial, and I'm reading this just as an example of how people are answering it and whether is it even meeting the need that we're wanting? I mean, is it answering our questions? Because I don't think we get what we think we are asking from any of the applications that were met. Then the second part, they said the agency.
Corey, can I interrupt just a moment? Given that we have a tight time frame here, at this point, we're looking at comments on, so the question would be, do we want that in the contract? Do we even have an expectation of what we might get with that request? So
not unless I think we give them almost like a model example of what we're looking for. And I think the other part that I would like in there is, for example, if we do not fund something, what happens, like particularly when it is a funding that directly relates to the numbers of people that will be served. I think the better thing to ask would be what other services would those people have access to? So in other words, like psychiatric, for example, if we do not fund it, where do those people go then? What happens to those people that we are no longer funding? I would be much more interested in having the answer to that question. Like what alternatives exist for them, if any, or what other supports they would be referred to, if any. I think that's almost a better question, or at least an equally important question that we should be asking. So I would love to see that in the contract. So
Let me
that's,
just, as we go forward here, some of this discussion really goes to, we're at a different point now. We have made our decisions about funding, and we're looking at a contract that would ensure delivery of the services that have been proposed.
True.
I agree sustainability is an important point that we're working on now. But I think, again, in the interest of time, because we've got a lot of stuff to
you're
talk
right,
about.
sorry, you're right, because I was thinking a little bit more about application versus the contract, so I apologize. Yes,
To do is
sorry.
focus on the contract itself right now, and I see your hand up, Susan. So, I mean, if you've got comments on the contract left, Corey, then why don't you go ahead and finish your comments, and then we'll go to Susan. But let's try to just stick with I'll use my lawyerese, the four corners of that document right now, because that's what our next step is with the agencies we've funded. And then,
Sorry,
you know,
I got off track. Let Susan go. Let Susan go.
Well, this is a follow-up to the sustainability thing. And I guess what I would like to see is that left in the contract. And then while you're working with Lori, Amy, that we could get a report back from what you've come up with, what that really means, and then present it to those agencies and saying, this is what and just let them know that this is the kind of thing that we're looking at for whatever sustainability is, because my sustainability is maybe different than somebody else's sustainability concepts. And so I guess that's where I'd kind of like to leave it in there, because we, or we're just kind of spinning our wheels all the time.
have anything else on the
I think
contract?
Yeah, I think that's a good point, Susan, and that's definitely something Lori and I are talking about, because if, for example, if there's a program that is dependent on $50,000 of funding and then they don't receive that, they may not be able to provide it. There may not be a sustainability plan because they may not be able to provide it because there's no funding. Like we're not making a purchase, so then they can't do it. But I think with that sustainability plan is also, especially like if you already have those people in it and it can't be funded the next year, like kind of what someone else was saying, I think Judy, like, what do you do with those people? Or how are they referred, or what are other programs that maybe they can go to? So I think I agree with, like, the sustainability plan is very complicated.
Corey, I saw you had your hand up. Another
Yeah,
contract?
back to the document we're supposed to be talking about. So the things I would like to see in that, and I will be honest, I have not read it as deeply as I probably should have before this meeting. I apologize, but I just want to make sure we've talked about the fact that in this year particularly, it happened that we had a contract that was not really met, and part of that was COVID related, but part of it was also the person, they did not have the person on staff. They had to go through the hiring process, et cetera, et cetera, et cetera. I think we need something in the contract that definitely makes the contractee have to report immediately to Amy if they're not going to be able to deliver the service, rather than let months go by and find out they weren't delivering the service, and they have to give reasons why and what their plan is for being able to deliver the service. And then I also think, related to that, money that was not spent, how are we making sure in the contract that money is returned to us, or, some sort of, it needs to spell out very specifically in each of the contracts how money unspent will be returned back to 553.
I can add in there about the January 1st. And so for 2021, there's only one new program, so I'll reach out, and they're already in the schools. So I'll make sure that they can start January 1st. So I'll add it into the contract, but it is already in the contract about the money that they don't use, and then like at the end of the year, how that specific contract that you're talking about didn't finish the contract. Technically, it could have been terminated by the Board of Health because they didn't follow through, but it's also December, so going through that process, but they not doing anything, haven't done anything with that service since October, and they're not going to.
You've got to have a check and balance piece where that information gets reported in a timely fashion, and we know that.
It was in the report. It was.
No, I know, but it needs to be more than just a slipped into the report. It needs to be highlighted and attended to. So, I mean, I think we need to have a way
I
that
attended to it to the person I was supposed to, and that was what I was told was it was towards the end of the year. But I think I told everyone that person was that the counselor was going to be done in October.
but even at but we didn't know at the beginning that it didn't get in place.
Yeah, no, not at the beginning. I didn't know. At the end, yes, I did know. I referred it.
Amy, I'm not making this an issue with you. I'm making it more, there needs to be a communication, and our contractees need to understand that they need to let you know immediately if things are not, if for some reason the service is not being rendered. That's what I'm trying to get at. How do we have that system very clearly articulated, and so it happens in a very timely fashion?
Well, there are provisions in the contract that address termination. And among the list of reasons is not performing. And, we should be getting monthly expenditure reports. So I think Amy can see if money's not being spent. So, I think the contract does address that to the extent that we have the right to terminate our contract if they're not performing. And so we'll just have to ensure that, I don't know whether additional contract language or it's just a monitoring issue for us to make sure that we don't allow months to pass before we say, you're not performing, we are on notice that we're going to terminate, you need to give us some cure that's out there. But Susan,
And the thing is, because we get stuff quarterly, that puts us, and again, I don't know if we need to be the body that needs to be, I guess I just want to make sure that it's very clear who's supposed to do what, when, with all the information. And I'm not sure it's real clear right now. Like who is the final authority that needs to be notified so a decision can be made whether a termination should occur, is kind of where I'm at.
And that's probably not something that needs to go in the contract, but it's a policy for the health department, I think. Susan, did you have any more on the contract, Corey? Okay, and so Carla.
As long as legal's looked at it, I'm good. Or will look at it.
Okay, so I had a couple comments. One was kind of following Carla. I know that it's been reviewed by legal at different times. I didn't know whether our current legal team had reviewed it yet. So if they haven't, I'd like to see that they get their eyes on it. And here are my couple things. I think one goes to the fees, but in the beginning, there's an attachment that we call a statement of work. And I'm a little concerned that we create a new document. I think that should refer to the application they sent us and not a new document. They have made a proposal and we've accepted their offer to do this and the terms set forth in that proposal. So I think we need to look at that section, and maybe you can get Samantha or Chris to look at it with you and remove any reference to a statement of work or creation of a separate document and make it a reference to what they provided to us in terms of the commitments they made when they applied for the funds. Because we're not going to change it now. And if you get two different things going and there's a question, as you said, Corey, well, are they performing? And we have a statement of work that's not quite in alignment with the proposal, then we have some ambiguity and a difficulty in enforcing our contract. So I think we ought to stay within what they have submitted as the statement of work.
So Hannah, for that real quick on the statement of work.
It's right, and it's sort of referred throughout them.
And I can send to you guys what I have been working on. But what I have been working on the statement of work for the applicant or for the contracts now. And so then what I do is I pull what they said were going to be the services, how many they're going to serve. I pull all of that from their application, and then that would go into their statement of work. So their objectives, so everything that they said they were going to do, the trauma-informed care, the equity. So then I would put all of that in there. Is that what you're
I would
talking about?
have a separate statement of work. They've submitted an application, and I would refer to that application and incorporate it in the contract.
Okay.
I mean, in that way, that it's their words, their application. There's no question about what they said they do. I'm sure you're doing a good job of translating it, but seems to me a step that we don't need to take. And as I said, you probably need to talk to Samantha or Chris about how best to do that. But I just think that we're setting ourselves up for potential problems when we recreate that.
Okay.
There's a reference in paragraph 2.7 about financial audits. Are we getting those? Just a question. Part of this is going to be reading this and looking at knowing that some of this has been the same year to year. So, and this has to do with some of the questions we've raised about the organizations. So just if that's in the contract, then we ought to be following up with that. I'm not saying it shouldn't be. I'm just was a question of whether we are actually getting those.
So we did financial audits this year and last year for all of the agencies. There weren't any.
Let me see. Did I end up? I'm looking for the copy of the contract here. I thought this was their financial audit, not ones that we
There's
do.
two different things in there. So there is the piece in there about their financial, like what they have agency or from the outside, externally, their agency audit, and then our finance department also chooses a month, and we look at their expenditures for that month, and we collect all their documentation to match it to make sure that it's correct. So
What
we're do
the
it also.
2.7 where it says the annual financial audit. And of course, that shows things more than what our money is. So that's, if we say we're supposed to get it, then we should be getting it. That's, and my next comment is the fee section. And I guess at this point, we're still following a process of funding 1/12 each month. We get the backup for the previous month, the next month, right? To see, but I guess is there some way to set this up so that once we make that initial payment, that we can actually just be reimbursing for actual amounts? Because at the end of the year, we're going to have paid them the full amount, and I don't want to try to get money back. I'd rather not pay it out. And I know the last month we may go back and now reconcile everything. Is that what you're doing? I just want to make sure I understand how.
So we have, even when Kathy Dreyer was in the finance department, we have talked about like the pros and cons of doing it both ways. And so our concern with doing it where we would pay them what they're actually expending is that some of the programs we would have paid them in full by like June or July, especially like the embedded school programs. And so then we're still have expectations from like the rest of the year, and there's no funding that is attached to that. So it's in the contract too, like if they don't turn in like the reports, or if they're not providing services, then their payment can be stopped. But if they've already received, our biggest concern is if they've already received all of the money, there could be less commitment to that program because of that. So with this year, what we have done is, so we monitor, each month they turn in their monthly expenditures. But for example, like January is not due until the end of February. So then it is hard to know what they're doing when it's happening, because we don't get reports until at least a month or so after it's happened to give them time to get the reports done. And so for this year, what we've done is we're moving towards the end of the year and we have paid a few programs more than what we've expended. And so what we've done is we've communicated to them that we're stopping payment until they have expended more than what we've paid them. So we're trying to prevent overpaying them. So instead of just waiting until December and saying, we overpaid you X amount of money, we need that back. We're trying to not overpay them. So then that way, that way we're trying to be in a position, and Jackie may be able to explain this more, but we're trying to be in a position where we don't have to ask for money back. So we monitor their EDFs, their expenditure sheet, their expenditure forms. We monitor those every month when they turn them in to see how much they've expended, where they've expended it, if they're following the budget. I hope that answers your question, Hannah.
Yeah, I mean, I guess I guess I don't understand how we end up paying somebody like the embedded schools. If they're doing work this summer, they would incur those staff expenses, how they would bill us the full amount in advance. But, you know,
Well,
I guess-
because for the staff, and then they don't do like just 1/12. We're paying, if we're paying 100% of a staff member, and it's only 20,000, then we end up paying for that part of that person before then. But I mean, I understand what you're saying too, but even with like the 377 board, there's a contract that and especially the embedded schools, that we tend to end up, they use that money pretty quickly, the Board of Health money pretty quickly. Because they go by the actual expenses and not just like 1/12 of how much they receive. So
Okay,
if someone 50,000 a year, we pay them that, they'll pay them that 20,000 from us first.
okay, so it's we're paying for part of a person, and so they're billing us for the first part, and then they end up paying the rest of the year with other funds. That's what you're saying. So I don't know if anybody has any thoughts on it. It's a clunky system in my mind, and I think it goes a little bit to what you said, Corey, is that we're paying out money and we're getting delays in terms of reports. So when there's a problem, we're a little slow in seeing the problem because we don't have that closer to real time information. So I don't know if there's a different way. I mean, the embedded schools may be unique to that, and then the other question I had is in the funding guidelines, that section, I can't remember what it is. We have a statement about, we're not going to supplant other funding sources, et cetera. And honestly, I have to ask myself, is that actually our policy? And what you just described is not that. If we're paying for part of a person who they may be getting what's the other part of that school therapist salary coming from? Is it coming from funds that were reimbursed to them through insurance? So, we're definitely blending money in that case. So I guess thoughts from the group on that. I don't like having things in contracts that we don't actually do or won't enforce. But anyway, so Susan, I saw your hand and a couple others go up.
Yeah, I think that is our policy to supplement and not supplant. I mean, that's been like that for years on our stance on this. And I guess that going back to even the paying of the fees, 1/12 of what, yeah, it's a clunky system. But I guess that to me looks more at accountability and kind of gives us leverage on that kind of thing. So it is a supplement, and if we didn't, I mean, we're not the finance people for all these organizations, all these providers, to see if we are supplementing, and because we don't get that information every month kind of thing. So I think that it really is supplementing and not supplanting. And if some organization had funds that they were receiving, and this has happened in the past, that all of a sudden, it was like with the United Way. A lot of these organizations had their funding cut by United Way. And so that our Board of Health funding isn't to supplant that, to take that place, you know, kind of thing. We're supplementing what they've already got. That makes sense?
Hannah, we can't hear you.
There is some language about, particularly with Medicaid reimbursements, that if they get Medicaid, that's it, and they cannot use our funds. And I don't know that we're really tracking that. I mean, particularly in the way that we make payment for Center for Human Services, for example, since we're not paying it tied to people. But, you know, I'm just raising that question. I am, you know, if people are comfortable with that language in the contract, and it's a message, and that's what we want. So if we're done with that, then the next item, and I think we still have a couple minutes in, and it kind of leads into what Amy was referring to, is taking a look at where we stand with the monies from this year's grants, correct, Amy? And what it's looking like at year end, whether there will be agencies who have not expended the full amounts. And,
Sorry, go ahead. Sorry, Hannah.
well, I know we talked about whether we could do this time or whether we'd look at it more in January, so.
Yep, I added it on there, and I think that the sentiment was if there was time at the end, we could kind of like talk a little bit about it, but to go over the money that still needs to be funded first. If that sounds okay with you, Hannah?
Yeah, that works, because I think we'll probably look more at that in January when you bring a report back to us.
Yeah,
Okay.
not know until the end of January how much money exactly wasn't spent.
So the next item, I think, so it doesn't get lost in the shuffle, is approval of the minutes for the November 2nd meeting. Does anybody want to make a motion to approve those minutes? Buchanan, motion.
Second.
And Poll, second. Any discussion, corrections, additions to those minutes? Okay, you want to take a roll call to for approval?
Hannah Eisner,
Yes.
Carla Pohl,
Yes.
Susan Schaefer,
Yes.
Cory Tello,
Yes.
and Judy Buchanan.
Yes.
Okay, now we're into the fun stuff. And I know that Jackie's here, and Judy, I saw your emails to her, so I don't know if you want to have Jackie addressed, just to make sure we all know precisely what we're looking at today. My understanding is that because of how the budget was built, that we didn't realize we still had $50,000 to allocate for grants. But if you want, Judy, was there something you wanted Jackie to address before we get into the thick of it?
I just wanted to confirm the 50,000 that you're referring to, is that those are dollars from this current year, 2020. So I wanted to know if that was there for us to use in our decisions today, as well as the available dollars from going forward in terms of the 100,000, where that sits. That there is money in the 21 budget for marketing and sustainability. That is separate from the 50,000 that we have sitting right now. And how much of is that sustainability and marketing piece that's currently in our budget? in the budget for 21. I just wanted to know what the figures were.
Okay, and I will let Jackie jump in. My understanding is that the 2020 dollars, if they're not expended by the end of the year, will just fall back into fund balance, and I'll let Jackie confirm or not. And then 2021, my understanding was that we have 48,000 currently. Well, it's split, so it's just 48,000. We have roughly, well, Jackie, why don't you just take it away?
Okay, you're correct as far as the 2020, that 50,000. Right now, it's still sitting in, it was budgeted to be pulled out of the Fund 109, the FFP balance. So if it's not used, it's just going to stay there. The money budgeted in 2021 for marketing and sustainability, just think of that as completely separate. So because it's budgeted in there. Currently, I have it split in a way where there is a portion of it, which would be 47,000 of 112 fund balance. I put in for agency funding. 48,000 of it is where I put into the marketing and sustainability line. 5,000 is in for mental health first aid training manuals that they get yearly. So that I'm not even kind of considering in that 100,000. So essentially $95,000, I split it in a way, but if Board of Health decides that they want it split differently, that is doable. If more is wanted to be pulled out of the fund balance and what has been approved in the budget, that will require a transfer. And, we'll have to do an appropriations.
Okay, let me clarify one point you made, because
Okay.
I'm using this 50,000 figure.
Mhm.
I like that we allocated 1.14 and some change in grants. Budgeted in the line for agency funding is 1.9. And so there was a 50,000 difference between the budgeted amount and what we allocated. I understand that when you said you put 47,000 in, that's the background of how that 1.19 figure got established. Is that right?
Correct. So yeah, 47,000 of that 1.193 was the fund balance. Yes, correct.
Go ahead, Susan.
So, okay.
Susan had her hand up, yeah.
Okay, so I guess where did the 47, the number come up with? Not where it came from, but where did that number come from? I got the 50,000 for the marketing, part of it. And so then you've got the 47,000. Where or why did that get added into that number?
Into
that
that 100,000, why is
Yes.
47? I personally thought that more money was going to be needed or wanted for agency funding. And I looked at what was used previous years and I added some more in there. And I left the line that originally had 50,000 in it. It automatically defaulted by a negative 4%. Like it took 4% out of that. And so that's why that's at 48 and not 50. So again, that was just me taking a guess at what might be needed in that agency funding line.
Okay, but so from the actual allocation though from the property tax and stuff like that without using any of the fund balance, there isn't that 47,000 to use if we did not. It would just stay in fund balance. Correct?
Correct.
Okay, thank you.
Mhm.
Carla, you had your hand up, and Judy, I think also.
So that spreadsheet that Amy Hancock gave us last month, it says 21 Board of Health budgeted, there's a total of 1.494. Where did that? I'm just trying to figure out where the numbers came from, because I thought that we had put the $40,000 into the out of fund balance into behavioral health, so that we had the same amount of money to spend this year as we did last year. But that sounds like that's not correct.
I'm sorry, you said 1.4?
Yeah, I'm looking at the
It was
spreadsheet.
1.14.
Right, but okay, so where did the 1.494 come from?
It was 1.14. It's never been 1.4. We were accidentally saying 1.4 at one, but it's always been, it was one.
That money was never there.
It's
No,
always
and
been 1.4.
one of the things that I think makes this a simpler process is we have gone through a budgeting process already. And yeah, Susan, you're right. The 1.19 anticipates a transfer of $47,000 from fund balance for those agency programs. And it's in the budget. So it's authorized and appropriated to be spent. We just don't, it hasn't been moved over yet because we haven't hit it yet in terms of the bank account. So the budget's been approved. A couple weeks ago, the county board approved the budget. Any changes that we want to make would be a budget amendment at this point, just to be clear. So I guess in my mind, to understand, there was $100,000 in fund balance that got built into this budget, allocated across the agency funding, the sustainability and mental health first aid. And the total numbers budgeted for those programs or whatever anticipate the movement of that money in out of the fund balance to pay for those programs. What happens sometimes is what happened this year with the 50,000 budgeted for this sustainability and marketing is we just didn't get it going. And so we didn't spend the money. But
But we
I don't,
did spend some money at the last board meeting. We did 12.9 for mental health first aid. And again, it's imperative that we get that finalized. So that comes out of the 20 budget. And I've asked some questions of some people, and we have to figure out who's doing what to make sure that gets spent in before December 31st.
some quizzical faces.
So, okay, so Jackie, if the money is already budgeted in the behavioral health, why didn't we just spend it last month?
Because we didn't understand how it was budgeted correctly.
Okay, I'm good now. I just want to be sure you weren't going on some Easter egg hunt with money.
Hannah found 50,000 for us it was Hannah. Hannah was on it and helped us out.
Is it 48 or is it 50? Because
48.
Which is it, please?
It's 50 for this year, 48 that's set in next year, unless you decide you would rather have more funding in that for marketing and sustainability, and we can move it.
I think the question, Jackie, is the agency money. Because
Yes.
it's 50,000, we still have the difference between what we've allocated for grants and what was budgeted is 50,000.
I'm sorry, can you repeat that?
There is a $50,000 difference between the amount of money we have thus far awarded in grants and the budgeted amount.
Okay.
Is that correct? I mean, I know you used 47,000 to get to the 1.19, but we didn't look at that when we were, so.
So do we have 47,000, 48,000, or $50,000 to spend today on agency funding? That is the bottom line question.
Well, I guess my question would be, how much have you already, I don't know what the number is that you've allocated in agency funding for 21.
That's your problem. So, not your,
Yes.
sorry. If you look at it, we were operating on an assumption that the 1.19 had to be reduced by 50,000 because that 50,000 was the marketing sustainability money. We did not look and see that there was actually a separate allocation or appropriation for that. So we left 50,000 on the table for the agency funding.
Okay.
So
And
today,
so-
right this minute, we have $50,000 to allocate. Is that correct? Just, can somebody please answer that? Do we have $50,000 right now?
Am I understanding?
She doesn't have the number we awarded, but Amy,
Jackie, yeah, so we have the 50,000. Jackie, they've decided on how to allocate that full 1.14, that original number given to them. So the 50,000, that was in a different line item for the marketing sustainability. So we have 50,000 to decide on today. But what Jackie, I think, is also saying, there's 48,000 that is in 21 budget for marketing and sustainability. So that 48,000 can stay in there for marketing and sustainability, or it can be moved to funding for the agencies.
So in other words, we have nine,
Marketing money doesn't have to be spent this year. It can still be spent next year. Sorry, Judy.
so we have $98,000. Is that correct? No?
well,
We could have 98,000 if we don't use any of that money for marketing and sustainability.
Exactly. So there's 98,000 on the table for
No.
whatever additions we might recommend today and sustainability and marketing. Correct?
No, it's all together. Okay, guys, keep in mind that we don't have funding right now to pay for vaccinations. Just keep that in mind.
well, the other thing to look at here, and I appreciate your comment, Carla, is we have a budget, and the budget has programs and lines within those areas. And in the health department budget, there's the mental health funding program. And within that program, we have funding that we've allocated for agency services, which is 1.19. We have funding that we allocated for the marketing and sustainability, which was 48,000. So in order to do anything differently, we would have to go in and make a budget amendment. So we have 48,000 right now for the marketing and sustainability. Yes, if we thought we really don't need that money this year, and we want to get a budget amendment going, but today I don't think we can presume that we have any more than 50,000 that we left on the table. And the question really is, what do we want to do with that 50,000 for today? I think if we get to a point saying, no, we want to spend even more than that, we'd have to go in and look at doing a budget amendment as well, and really digging down into how much we need for marketing and sustainability instead of just wiping it over. And it may be, Carla, as you said, we're going to have some major needs that may have to come out of budget amendments this year, or they might come out of fund balance. So I think where we can go today is we have that 50,000 that we did not allocate. And in my mind, I thought maybe we could take 3 different approaches. One is we don't have to do it at all. We could hold that money and decide that there may be needs or programs. We could consider whether we would go back to those agencies that we did not fund at all, and whether we would use that money to fund them, or whether we want to just look at those organizations that we awarded money to and whether we can adjust the amounts that we provided them. So I don't know if anybody's got some thoughts. I'll open it up and see where we go from here. I saw some head nodding when I said leave it. So anybody want to address that issue? Corey or Susan? Susan and then Corey.
I'm not opposed to leaving it. I did notice, and we all got the thing on Project Oz, and to me, that request that they made on that actually makes a lot of sense to me for what they're asking for. to finish out the school year. And so that is something I think I'd like for us to consider, because it makes sense. It makes sense to finish the school year correctly with what that program is. And but after that, I have no problem leaving what's left after that to maybe see what we come up with in another month or two, after we see what kind of things are going on. You know, a pop-up need of some kind that would be very short term. And so that's kind of where I'm at right at the moment. And I'll, you know, like I said, the only thing that I see is I think that Project Oz makes sense on that, what, Too Good for Drugs or whatever.
Anna, we can't hear you.
Yes, okay, I'll just stay unmuted. Okay, Corey, I think you had your hand up, and then we'll get to Judy.
Okay, so I completely concur with what Susan just said. I feel like the Project Oz thing, that is a minimal amount of money to be able to have closure for the schools and the agreements they've made with those schools to be able to finish out the school year. And I also think it gives them time to try to find other funding if, you know, going forward. So I think, and yeah, I think that's very reasonable. I would very much question leaving money on the table right now. I mean, I get that there might be a need that pops up, but I feel like right now there are needs that we are hearing, seeing, knowing about. And I think it would be somewhat irresponsible of us to money that has already been earmarked for behavioral health to not put it forward for people who are right now needing the services and going into a very bleak upcoming months. And so one of the things I would propose is that since we funded CHS psychiatric at less than they asked for, and they were able to give us information indicating that would throw 63 people that would be unfunded, 63 people that are currently receiving such services would be no longer served. I think about 63 people's lives. I think about their lives, their families' lives. I think about what that does to 63 people. And I question if after we've taken out the money allocated for Project Oz, if the remainder of that could go back into psychiatric to serve as many people as we can serve. Unless we have information that those people can be served in some other way. And granted, we have some new county programs, but that's not psychiatric. I mean, it's very different. We're not talking about giving them mental health counseling services, which possibly could be met some other way. We are talking about giving them medication management, support for, you know, it's a support system that's been built in. And I just think we're taking it away. So.
Judy?
Yes, thank you. And I agree with both Susan and Corey on the proposal from Project Oz. I think it was very reasonable, and they, in good faith, you know, have had a relationship with the schools, and I think we owe it to them to do what they said they would do in terms of trying to secure additional dollars, but get them through the spring. In terms of the $34,000 that would then remain, I really would encourage us to think seriously about making an additional amount available to CHS. If, as Corey said, there were 63 individuals, and possibly even more than that might not have that psychiatric follow-up. And we all know for people who need the medications, what we're going to produce if they don't have those medications. We're going to have people that are much more seriously ill and on the streets and trying to get into our hospitals. The 34,000 would knock down at 63 by about maybe providing services for another 20 individuals. And I think that that would be a good investment and something we should consider. Right now, we are not aware of anyone else that can do that service. This was the only proposal that surfaced as being a legitimate proposal. So that it's not like there's someone else out there that can take up the additional people that are going to need this care. So my recommendation would be to additional funding to CHS.
Carla, do you have any comments?
No, I even could make a motion that,
Can't hear you, Carla.
You want to mute Carla?
I thought I clicked, sorry. I just need to know I can make a motion.
Okay,
I don't know what the amount of money is for Project Oz.
16,000, I think. is
So I
what the-
move that we allocate $16,000 to Project Oz and the remaining amount of 34,000, is that right?
Mhm.
To CHS for psychiatric services.
Okay, do we have a second? Judy Buchanan, second. Okay, discussion. Susan, or is that a thinking finger or a hand up? Yeah, okay.
It's kind of both. I had a question and then I can't remember it. Oh, okay. Now I remember what it was. I guess that this ties back into our earlier discussion on the sustainability plan. I guess this is where is the sustainability plan for psychiatric from CHS as to how they are going to sustain psychiatric in any way, shape, or form. If they're psychiatrist, they have the psychiatrist that we utilize in many areas, not just, Board of Health funding. And what is their sustainability plan should that psychiatrist leave for any reason? And I guess that to me is a sustainability plan. And this kind of ties into this too, our funding for this. That I guess that's a comment, concern, whatever.
And just real quick to add to that, they have a psych APN that sees most of their clients. And then the psychiatrist is the one that provides, I don't know the technical term, like supervision to that psych APN. And so if their psychiatrist leaves, they would have to find a psychiatrist to provide supervision to their psych APN. So it's not just a psychiatrist. And it's actually, I don't remember her last name, but it's a lady named Beth that is a psych APN that sees most, if not all, of the clients, and then the psychiatrist supervises her to be able to do that.
And I guess that is what I'd like to see in a written plan as to how they would address those kinds of issues with that. I guess that's just, to me, that's part of this discussion.
Corey,
So just doing the math, I asked Amy to reach out to CHS and ask them what the cost per client in adult psychiatric is. We knew what it was last year. It was $1,850 per person. They gave Amy a newer number that's slightly less, $1,839. So just doing the math right now, if we give them back $34,000, that only really covers 18 and a half of the 63 people they are dropping because of the amount we cut. Adding the 34 back will allow them to pick up 18 more. So that still leaves 45 people that are not going to be served according to what the pot of money we're giving them would be. So my question too is, what is going to happen to those 45 people? What are they being directed to? What's the, what safety net do we have in place for people that even ones that will turn up and need services beyond that? What really is the community plan for serving that gap? And so I agree with Susan. It's like it's a bigger picture thinking, and certainly starting with what happens if we would lose a psychiatrist, but also just what other supports or case management pieces are available from anybody in the community.
And I just want to weigh in a bit here. I mean, I'm been a little disappointed that for the past at least 4 years, if not more, we get the same concerns expressed by CHS in terms of the funding. We've lost this and that in funding, and we have not yet seen anything from them that shows anything about finding additional dollars beyond our property tax money. So I'm a little concerned, and we don't get this from our other agencies that we fund. I mean, I think we got Baby Fold saying we'll try to take a pencil to our budget. Project Oz is coming back saying, you know, we can try to make it work, but can you give us this much? It's significantly less than they asked for. And I just feel like, you know, what happens to me, Corey, is that they're committed. They are a community mental health center, and they do have significant reserves. I mean, if you look at their balance sheet from 2018, they're 990, which is what they file. They have about $7 million in reserve. Now, should they be spending that and just spending it down? No, but you know, if we're all in this together, we've increased our funding level to them beyond last year's. And I would like to see a commitment from them to say we'll continue to serve those people in need. We don't give them money based on a per capita basis. We give them money that they then allocate to staff that then goes forward. And I just would like to, instead of saying, we know we're going to cut X number of people, to say, we'll do everything in our power to keep that client base what it is. We know people are in need, and you know. So I find it a little disconcerting to get that kind of, okay, well, what do they expect us to do? I mean, we only have so much money. We've had to make cuts to other agencies. So show us something about what you can do to find other funding sources. I don't know if there are any, but.
Well, they did get funding from John Scott. I mean, John Scott's now paying for half of the money that's needed for that program, and that's relatively new.
How much
They're
is
funding 300. I'm sorry, they're funding. Let's see, all funding sources comes out of. Yeah, we were going to pay for 300 people, and John M. Scott pays for the other 300 because they were talking about in our application starting with covering 600 and 300 of which we pay for, and the other 300 is CHS. I'm sorry, Scott.
I'm not remembering, but I think the budget they provided showed what, 100,000 from Scott? Was that right, Amy? So they can serve
I'm looking, it sounds right, Hannah.
Then we're way overpaying.
Forgive me. Okay, forgive me.
If they can cover 300 people with 100,000, then.
Let me double check what it's in the thing, because we should know that exactly. And it's in here.
Susan? Yeah.
Well, and I agree with what you were saying earlier, Hannah, and it goes back to my request that I had about the financial statements, which is on their website, that anybody can request their financial statements. And yeah, I'm with you, Hannah, on that one. And they are the community mental health provider and their mission statement is to help those with behavioral health needs. So are they fulfilling their mission statement if they continually reduce the number of clients that they see?
Yeah. Judy, I think you were first.
Yeah, I think the question was raised about what are their plans for securing other dollars, and I know that they did receive the Scott funding. If it was $100,000, that's just a very small part of $1 million it cost them to provide a psychiatric follow-up. So if that's the case, and that's new for them, I don't believe they have a lot of options, but they have explored a few, but they did reach out to Scott and were successful. So I believe that the question of what would be their plan in the event that Dr. Abuelita were to leave the center, what would they be doing? That's a legitimate question, and that would be one I think we could ask them of, provide some feedback on it for yet 21 contracts.
I want to clarify what, I agree with what Judy just said, but I want to clarify, I'm looking at the application and I apologize for putting out misinformation. I detest that when that happens. So I want to be real clear on the record. So what the money they ask us for, they indicated that that percentage of funding that they initially asked for was 50% of what they needed to operate the program. 34% was going to come from fee for service. 16% was going to come from another source, which is Scott. So that gives us the 100%. And that's, I was confused because I knew we were only paying 50% and I forgot that 34% of that was fee for service. So we need to be real clear that they do go after other money for fee for service. They are getting additional funding from Scott. So they are asking us for 50%. So I think we need to be real careful too when we make the claim that, they're not doing anything else except waiting for us to hand the money. We provide 50%. And but now we are providing, less than that. So I think we need to, be clear on that.
Just real quick, guys, a reminder that Jackie has to leave. And so if you guys have any other questions about, for finances, she's getting ready to leave. Thanks.
Anybody question for Jackie? Yeah, Corey, no?
The other thing I want to do is, Susan has asked for very specific documents and I had it written down, but now I can't find it. Amy, do you remember I passed that on to you a while back. I had it here. I specifically pulled it out so I'd have it available and now I can't find that document that Susan specifically asked for. But we want, I think it was the 990s, right, Susan? And what was the other? There were two things you wanted. Their 2019 audit sheet. It was their,
Can I give you-
so I think we should go with, I think we should request that.
So Jackie, I think, is free to go. Nobody has any questions for her now? Okay, great. Thank you, Jackie, very much.
All right, thank you. If you guys do come up with any other questions, just go ahead and email me.
Okay, thanks.
All right, have a good rest of your day.
And sorry to interrupt you, Corey, but I didn't want her to be hung up, so.
Sorry, I thought she already knew she could go. I'm sorry. So yeah, I think we need to, we rotate around the same thing year after year after year after year. We make the same claims and we never get closure because we never, and I feel like it's unfair to us. It's unfair to CHS. It's unfair to the messages we're putting out into the community about this. And so I think if getting that financial information will help once and for all settle some of the concerns that some of the members of this committee have about how they are using their fund balance, then we need to get it. And so I think we should make an official request. And I guess I'm asking, Madam Chair, that's probably up to you to decide that. But I think we should ask for the 2019, 2020 990s, correct, Susan? And then also the 2019, it's the audited financial sheet, I believe you called it. And Amy, I don't know if you have that email I sent you where we had articulated exactly what we were asking for. I can probably find it again real quick.
Yeah, the 990 and the audited financials from their external auditor.
And do we
I've
want
received-
that for 2 years for 19 and 20 or just, I know you
20
want-
isn't done yet. 20, it ended June 30th of 19.
And the 990s are available online. I know that the 2018 is there, but the 2019 is not out there yet. I don't know if it's done and just not. Do you
They
know?
need to have the financial statements to create the 990s, so I believe so.
We may not be able to get that information until 6 months, sounds like.
Well, they were due November 15th, I believe.
Okay, so should be out there soon. Yes, Judy?
Okay. Am I believe I understand we want to review the 990 and the financial audited statements, and we're looking at what use they are, the amount of their reserve and how they are using it. Are they drawing down on it in a regular way? It was my understanding when we met with them about a year and a half ago, that they were doing that. But my question would be, are we saying that we're going to ask for that information and delay a recommendation and approval? I really think we need to move ahead. There are people that are going to be hurting if we don't. And it's made very clear to them that those statements and that information is a request that they need to abide by, and that will influence, our continued ability to work with them. But I think for right now, we need to move on.
Yeah,
But-
when we have a motion,
We can make a statement, because as Corey said, we're doing the same thing we've done in the last several years, and we end up at the same place. So I think that if we review those documents after we settle up on the funding for next year, and it's simply, they are not drawing down to the extent we think they should, then we can make some kind of a public or a statement from our board to let people know that it's not just us being unwilling, because we're drawing down on our reserves as well. But I think it behooves us to get them, to review them. And then if we understand what it is, and we have a policy that says you need to be spending down more of your reserve, if that's in place, then we make a public statement that they should be doing that for the future, so we don't jeopardize the people who need it right now.
right, and so, right, we have a motion on the floor, so I don't know if after, why don't we, anybody want to call a question, and we'll have a vote and see.
Call the question.
I just
Yeah.
wanted to, I'd just like to ask Amy to clarify the total number then that would be allocated from what we had previously had said at the last meeting, and then add this number, because I don't have my worksheet out.
Um,
So I'm going to attempt, oh, I'm sorry, did you want me to do that now?
Yes,
you have the number. I've got the number right here too. Mhm.
So I'm going to go ahead and try to attempt to share my screen. Okay, I can't because I'm not the presenter. So the number we have to fund is 1.193623.
Are we talking just CHS or the total?
we just need CHS's number.
Yeah, okay, just CHS.
Oh, how much total that we would fund CHS with the added 34,000? Okay, I have to get out my calculator.
435, 166 plus the 34. Mhm.
Okay, so yeah, it was approved at 435,166.98.
Hmm.
And then plus the 34,000 is 469,166.98.
Mhm. Okay,
Is that what you have, Ms. Judy?
that what you wanted? Someone asked for that.
Yeah,
Okay,
Susan,
but that's the figure you also got, Judy, was the 469,166.98.
Yeah, well,
Okay, good.
Susan, you raised your hand, I don't know if you were.
Judy called the question, so I can't really ask another question. I think that's the correct procedure.
Okay, well,
If
you, okay, well then let's vote. We'll take a roll call, Amy?
Sure, Hannah Eisner,
Yes,
Carla Pohl,
Yes.
Susan Schaefer,
Yes.
Corey Tello,
Yes, and we're voting on both 16,000 for Project Oz and 34,000 for CHS Psychiatric. Okay, yeah.
Right.
and Judy Buchanan.
Yes.
And then Hannah, just real quick, as far as like the contract, the 16,000 for Project Oz to finish out this school year, then I'm assuming they would only need a 6-month contract and not a 12-month contract, since it would just be through the school year.
That would make sense, and I think they submitted an application, so what I'd say is have them submit a new budget for the 60,000. And the same with CHS, we'll need a new budget from them reflecting what. Yeah, Carla?
I'm working on the Board of Health agenda. So, and I have no memory. So do we bring this whole budgeting amount to the board last time, or do we need to do that this time?
We approved the 1.14 last time, so it's just the 50,000 that still needs to go to the board.
Okay, so it's approval of, do you guys want to specify who got what in the, okay, so 48, and Amy, send me the numbers, please. So I can get this.
No. I will, and I'll send them to Jessica, and I talked about this yesterday, and so I'll make sure she has it too.
Okay, so 16,000 to Project Oz and 30 something to CH.
34 to CHS.
34 to, okay.
And, just as a final comment, I know that, we have certainly gone around and around, and I just would like to invite CHS to join us, and everybody working hard to find whatever the money is, let's find it, and let's, show the commitment that we all have in this community to doing our best to serve these people. And that's all my comment was intended to convey to them, or, as we move forward. It's just a little bothersome to get these, okay, then 5 people are left off. Well, we're doing what we can.
And if I might just mention, in some respects, I think CHS was led by a different director, but really used some initiative to put them in a position to do what they've done by recruiting a psychiatrist and offering that person an opportunity to have a private practice separate from their contract. And I was on the board at that time of CHS, and that was to provide for where we are right now, because they, as well as we've seen other agencies trying to recruit psychiatrists, it's not easy, it's very costly. So I think we have to acknowledge that some action was taken before that really has enabled them to make the most of that.
Corey?
Yeah, and I think that the other thing, and I think Hannah, several of us have brought this up at different times, but we also need to look at the full continuum of what's been added for people who are frequent utilizers of the system, which some of the adult psychiatric clients certainly probably would be. I don't know if they actually are they're probably not in the FUSE program per se, but they are users of the system and because they are chronically, they deal with chronic behavioral health issues. So I think we also need to look at where all the different continuum pieces on the continuum, how they're serving these types of clients, and are we actually having other means of serving some of them, or other supports now through FUSE, through triage for some of these people, so that the only game in town for them, in terms of at least some of the case management and some of the support kinds of functions that psychiatric does, can they be met through some of these other pieces that have been added? Certainly not the medication management, but some of the other that are more like the case management supports. So I think we also have to get more savvy as we've built this system, as we've added to the system, is how all the parts are working together, and we need to know that, because that tells us what's still unmet, and what needs to be expanded, and where gaps still are. So we really need to really double down our efforts to get as educated as we can on all of that.
Yeah, I think maybe back in the day when the mental health action plan was being put together, there may have been some data gathering on, where people get psychiatric care, but it might be time to look at that and see. I mean, Chestnut is doing some of that at the FQHC, either through telepsych, I think, at least that's what, as I recall in their, when they've talked about it, or else using primary care with support to do some prescribing for less serious mental illness. So I think you're right, Corey, it'd be great. And I think as we meet in our months out, we can start doing some of that stuff and looking at that. Yeah. Yeah, Susan.
I believe that is going to be addressed through BHCC.
Great. Right, so we'll have a lot more data to work with next year when we do this all over again. So we did have the item for looking at next year, or whether, how it's going to look in terms of funds and expenditure of funds for the grantees for the 2020 cycle. I don't know if people are interested in going down that path now, or whether we just adjourn our meeting and look at that next month. Corey?
I just want to make sure, and I tell me if I'm bringing up something that this is the wrong place, wrong time. But again, we allocated at the last board meeting, we allocated, 12.9 for mental health and first aid, conditions around that, bring a trainer of trainers, pay for materials and participant costs. And then we also asked for up to, I believe it was $4,000 for marketing, and that would, for looking at a variety of things. We really would need to spend that money, I believe, by December 31st. And I confirmed that, again, with what Jackie said, but she needs like POs and everything. And part of the problem is some of the services, like, for example, if we pay for billboards, if we pay for 3 months of billboards, marketing 211, that's already paid up through December 31st. But if we could pay now, and I guess this should have been a Jackie question, if we could go ahead and pay for that through March, for example, and we can get a PO saying that we're paying for it for the, the first 3 months of 21, do we know if that can still meet that requirement for being in the 20 budget, because we have to purchase those services ahead of time to get them?
Yeah, I think that's definitely a Jackie and Jessica question, and maybe Ms. Pohl. I think that, that there needs to be some meeting of those minds to find out what is concrete. And I mean, there are some ways of earmarking, or at least getting money committed, even if it's not spent until, I forget whether April of the next year, but as long as it's clearly been, the service wouldn't be delivered till later, but there's a contract entered into or something to reflect that, then you could use the current budget year. But that's a Jackie, that's a...
Okay, so can I get, what I need then from this group is who exactly is in charge of moving that forward so that it happens by December 31st, because the clock is ticking. And my question yesterday was, Jackie was very clear, she needs a PO, she needs, a contract and all that kind of stuff, which I completely agree with. But my point is, who in this group is responsible for making sure that ball gets down the court by December 31st and all of those things happen? And Maureen Solers, I asked her about her role in this, because she, through AOK, is part of the consortium within the community for mental health first aid. She did not feel comfortable with the money part of it, which I get, that's not her role. So, but I guess it's like, who is the person that's going to actually secure the contracts and secure the POs? Because I don't think a board member should be doing that. I mean, I'll do it if nobody else is going to do it, but I don't think that's appropriate. And so I need to know if that's accurate.
Don't you think Jessica needs to answer that question? I mean, it's a
I was
staff.
gonna say,
I mean, it may, whether Jessica says, okay, Amy, it's up to you. But you're right, Corey, we don't want to sit around and then have the time pass. But you're right, the board, it's not the board, and I think that when you guys presented that, the question was asked, okay, how does it move from these great ideas into the implementation? And I think everybody acknowledged that it has to be something that department staff take on, so.
And we
if-
know the concrete, we know what we're buying. We know exactly what we're buying, what we want to buy with that money. So we just need to make sure it gets bought before December 31st, and there's proof of that. And it's all done with integrity and, so that's, I need to know who moves that ball and who holds that person accountable so that ball gets moved. So it's all closed up by December 31st.
That would have to be Jessica, since we've already approved the funding for that. That as long as she got a contract, like for billboards, like when you use billboards for an example, or if you ordered the materials for the mental health first aid, if you have gone ahead and got that far, even if the bill comes in January, we have entered into that contract, and that money, and that's what gets cleaned up at the end of the year, with their end of the year cleanup on budgets and stuff like that. And when they reconcile all of those things with the treasurer before the audit, I believe that that's how it works. Am I correct on that, Hannah? Is it that they've got a bill that they, you get a bill in, December 20th, and you don't pay it until January. I think it's still in that December 20th year. I think. I'm not sure. I'm not the accountant, but that's the Jackie part of the question.
Yeah, and I think it just is a matter of who gets, is this a health promotions project? I mean, I don't know. And I guess, Carla, I was looking at you. You can't see that I'm looking at you, but I am. Because I thought, and I mean, poor Jessica, I mean, she's up to her ears in many things. So it just needs to be the right staff person who understands the urgency and will move it forward.
We do have an assistant director. We do have an assistant director.
I talked to Jessica this afternoon, and one of the problems with with counting on health promotion is that they don't have the staff to do it. They've lost a couple of staff members. I'd suggest that that Amy and Jeff do it. Otherwise, it's not going to get done. I mean,
Are we
the rest-
talking about the billboards or mental health first aid?
Both,
billboards?
everything.
The
That's
billboards?
the biggest amount of money. I mean, if you guys know of other staff in the health department that are not dying from not being able to take vacations, working overtime because of COVID, let me know. And and I trust.
No, I think it's all of us at this point. But no, I know it's all of us at this point that have to chip in with COVID and vaccine planning. And we will have vaccine clinics soon. And so it's definitely not a matter of trying to not do things. And so just make sure, like, you guys are taking this to Jessica, and then Jessica is bringing it back. I kind of got a little bit lost in the conversation.
Judy, trying to say something?
In fact, these are questions that I've scheduled some time, Corey and I've scheduled some time with Jessica to explore just who's going to be taking the lead. And it may be that this one time there may be some more volunteer engagement in this than there might have been before, just for a one-time thing, as well as as I said at the board meeting, this is going to be a slow rollout. So it's not like we're going to take the whole media plan that they've already got going from health promotion and then dump a big one on from ours. I think that there are reasons why we intend to go slowly, but we are going to ask Jessica these very questions and be as helpful to her as we can in terms of doing some of it. So just to let you know that.
Yeah, Susan?
Well, and the other thing to consider is that, yes, if we don't spend it, then it goes back into our general fund, in the 112 fund.
Yeah.
And And so there's nothing stopping us, even if it goes back into that 112 fund, or if it came out of 109, it didn't get spent out of 109, it stays in 109. There's nothing stopping us from 3 months from now taking and going in and making a budget adjustment, a budget amendment, and saying, well, we're going to take that $50,000 out of wherever it was put in, kind of thing. It's not like it's gone from the health department's, or the Board of Health's availability. And so there's nothing stopping us from doing that.
Yeah, I think Jackie as much as told us that early on.
And there's
Except that I worry that if the vaccine thing hits and we don't get the money we hope we're getting from Fed or state, whatever, every penny will, and understandably, and I want to do what's the highest priority at the given time. So I'm a little nervous that if we don't do it now, it may be lost, and for many reasons. So, and plus, I just think I get very tired of us not closing on things, and that's going to be my goal for every meeting we have from now on, is that at the end of the meeting, there is a clear action plan with who is doing what by when and what they're going to report back, because I have been on this board for a long time, and these same issues, literally decades, come up over and over and over with no closure. It is time, people, this committee is the right committee, I believe. And so we've just got to get closure. So sorry, I'm on my soapbox today again.
fair warning, huh? Yeah. But we do have the 48,000 budgeted for 21. So as Susan made, I think, comment, if this has to bump and because of just what's going on and staff exhaustion, then we just use that money to do these projects in 21. I think if we need to, and I don't really know what we're looking at in terms of the cost and the distribution, et cetera, for vaccine, but I would not think, ultimately they may go in and redo our current budget, but my sense would be it would not affect the funds that have been budgeted already for this year. There might be some looking at fund balance for sure. And that may affect whether we could go back in and say, well, we need 50 more than the 48 budgeted this year. But I think the projects that you guys sort of set out at this point, you could do with the 48,000, don't you think?
Well, unless there are pieces, for example, if part of what we're trying, obviously the whole point is marketing 211. So people in our community who have gone through extreme duress because of pandemic, social injustice, et cetera, if we want to get services to them, particularly through January through April, or January until the vaccine actually is going to, kick in enough, we're talking at least 3 months, easily 6 months. So we want to make sure that we aren't putting this off, because the reason we want to spend this money now is not just to spend it in 20, but also to secure the services and activities that we want to happen. If 211, as we market it, if we find out that all of a sudden PATH is flooded and needs more support, then dollars may need to be put toward giving PATH more financial support for either additional part-time supervisor or whatever. Or so I just think we need to be aware that there may be some additional costs with marketing if we're successful, and the needs are as apparent as they are, and people start actually using the service.
Well, I guess my final word on this is I don't think our committee can designate or assign staff to do this. I think that has to be done through Jessica, and it sounds like you guys are meeting with her, and maybe she will have some thoughts on how to do it. And you're right, Judy, it may be this is an instance to do this that you or Corey might say, well, we can go run and pick up the contract and bring it to you to save staff time from doing it if it's a standard. I think that's got to be something in my mind that you would work out with Jessica and Carla. And as this thing grows, you're right. If we see something where funding another agency becomes something, then that's a little different proposition, and we'll have to I mean, it may be, but I think,
Although, I mean, it did, Jackie has made it clear over and over that the basically now what's left is still around, I don't know, $98,000, between the 2 years. At this moment, there's $98,000. And so, and she's made it real clear that she built it so that it can be used pretty flexibly. And so I think that was wise on her part. And I think that is good for us to be able to pivot to, as things happen, we can pivot and do what we need to do to meet priorities.
yeah, Susan?
That reminded me of something that I thought of earlier. And since we really don't know what's going to happen in this next year, when it comes to budgeting for 2022, and since we are the budgeting or the policy and stuff like that, I guess maybe we should possibly think of not having or having a direction of to not automatically put something in there from an unencumbered fund balance to on at least on this area, so that we can make sure that we know what we have, and we don't, like I said, we don't know where we're going to be next year, but I think that we shouldn't make some assumptions like that. And when we actually do our budget and just look at what has been budgeted property tax dollar wise for that, and then let the Board of Health or this group then say, okay, this is what we want, this is what we have budgeted, and then when we're making our funding decisions, recommend if we want to take any money out of an unencumbered fund balance to do anything additional. I guess that's kind of my thought on that. As to with this 100,000 that was budgeted this way, that was, I mean, just something for future thought for our, future, meetings and to where we want to go and how we want to approach things. So we'll probably have this discussion every single year, and Corey wants closure, and Hannah at the beginning we said we're just going to work with the dollars that were allocated here and not take money out of unencumbered fund balance and stuff like that. And I think that maybe that's where we should always have our base is that point, and then go forward. Like I said, we don't know where we're going to be 6 to 9 months from now, and I guess maybe if we just want to have a thought process going.
Carla?
I just have a request of you, Hannah. When you during the Board of Health meeting, when you do your report, if you could just explain where the money came from without using the fund balance, the fund numbers, because I think
Okay.
it confuses the heck out of me, and I should be able to follow what a 107 and a 112 is.
No, that's fine. I mean, yeah,
Okay, just give a brief history, and so that when they see why we're approving an additional 50,000, someone doesn't come unglued like me.
yeah. I mean, it's pretty easy if you don't, you either, what Jackie was giving us is the rationale and how she came up with those final budget numbers. I'll just stay with the final budget numbers. That's all we need to do. And
That's fine, and because I think when you see I sent you guys the wording, when you and Amy see the wording, it's pretty self-explanatory. Yeah, but if you could just, when you give your report, just kind of give a brief history, then I think the action item will go smoother.
Not a problem. Not a problem.
I'm all for smooth functioning and a short Board of Health meeting.
Good luck on that.
Yeah,
Cool.
it was a real dream, wasn't it? Sorry.
One of the things that Judy and I want to talk about tomorrow is, making sure we're coordinating with the health promotion department. You're telling us now that the health promotion department is like, are they looking to hire to replace those positions that they've lost? Is it already posted? Those positions posted? Do we know if they're posted?
They were actually interviewing about a week ago.
Okay.
And they had been posted and they were interviewing. So there may be some on the pipeline that's coming on board.
Do you know how many? Do you know how many positions, Judy? Do you know how many?
3.
3?
Do you agree? 2 or 3?
Well, and it's interesting because I think as we evolve, the health department evolves. I think health promotions, in my mind, probably, and many people dealt more with physical health issues. And I don't think we've looked at the health promotions as also looking at mental health issues as well. And,
Well,
we've come into that.
We
So
were,
it'll be a good start
there's
on
an opportunity to kind of piggyback as you look at the overall healthiness that includes mental health, but we'll see.
And I can actually give a real quick update on health promotion. So they have a newer supervisor, Lucy Alvarez. She was promoted to that position. And so Jessica is her supervisor, but I'm her mentor, since she's a newer supervisor. And so we meet weekly just to go over like how to do documentation and leadership. And so one of those positions that is vacant right now is the communication specialist. And so that's such a huge piece in like promoting. And so she did have someone, I think, that was hopeful, and I think that is no longer hopeful. And so that may be delayed. But she will, as of middle of December, she'll have 2 brand new people. And so they have a lot of great background. But since I have been at the health department for the last 2 years, health promotion is the program that I collaborate with the most. And so they definitely, from our collaborations, they still do like diabetes, healthy living. All of that still has the behavioral health piece to it, like people are stressy, or if you try to quit smoking, you may eat more. And so they do work on like the mental health piece. We collaborate on that, but it's a very kind of like newer team in the past month, where they're all trying to figure out their place. Most of them are trying to figure out their place also within the team.
Okay, well, I see we are getting about 15 minutes to our hard ending. So we don't have to go to 4 o'clock unless we want to. So if we're kind of set, then maybe anybody want to move to adjourn, and Ms. Poll?
I move that we adjourn, unless you guys have something, unless there's something else for the order, good for the order.
Corey, you look like you're still thinking.
No, I just am concerned. I am very concerned for everyone that works at the health department. I listened to, I don't know if any of the rest of you, there was a webinar yesterday on leadership fatigue. And I look at every organization that I'm involved with and think about what people have gone through for 9 solid months, nonstop. And, they're just expected to keep going. They're expected to meet the next challenge, the next challenge, the next challenge, with no downtime. And then when I hear that we've even got departments that aren't even fully staffed and trying to meet to these challenges, I'm very worried about just our community of everybody that's a helper, everybody that's in charge of trying to meet these big behavioral health needs and other types of needs. And I don't know how we give grace. I mean, I guess what's so hard is, that you want to push right now because there's so much need. You want to, build and go forward as fast as we can and as hard as we can. And the only way you do that is by the people that are already stretched so thin, going one more step, one more mile, one more mountain. And so I just worry about how we're going to keep it all together for the next 6 months, and give grace to the people that are already stretched very thin, and yet not drop the ball on meeting the needs.
It's kind of like our thing at this point, because it's been the entire year, is like, it's like running a marathon for this year. But now that we're hoping that the vaccines will help end this pandemic, it's like the last half of the marathon is like you have to run uphill. So it's like you get like a little relaxing. It's like, nope, you have to run uphill. And the vaccines could be out as soon as like the middle of December. And everyone that works at the health department is to participate in that. And that's our top priority, is to make sure that we get that out. And so, and everyone's job has changed. Even like the behavioral health program, we've done COVID testing. We've helped pack up the van for COVID testing. We've done contact tracing. We'll have to help in the vaccine clinic. And so no one, yeah, it's definitely a lot. And the other stressor of that too is like, there's so much that is unknown. So there's not, you know, like you can plan, like there's just a lot that is constantly being changed at the state level and the federal level, and so much unknown that it's just hope that eventually this pandemic will end, but, when we get these vaccines out. But it's really, really hard, like, to think about taking on anything at this point with so much like other things that are the top priority.
Yeah, you're not only going up a mountain the last part of the marathon, but you're carrying a backpack with about 80 pounds on it
Yeah.
at least.
And it's so hard now because people are so anxious about the vaccine, and it's really doubly important for the community to really follow all the guidelines, and it doesn't appear to be happening. So it's just,
You know, and I don't, is that something that marketing, I mean, our marketing is for 211, but everything is so embedded. I mean, the trauma coming from being fearful about COVID, the mental health issues coming from being isolated because of COVID, it's all mental health. And so, you know, with this marketing that we're trying to do, I mean, and I guess that's what Judy and I are going to talk to Jessica about tomorrow, but, you know, is this marketing also about getting the word out about the vaccine, and, you know, how, you know, what are realistic concerns and how those realistic concerns can be addressed. And I mean, marketing takes on a different and maybe a more urgent layer if we start thinking about marketing for the vaccine as well. If we're, you know, so.
Can I just
All
say
right.
one thing quick, Hannah?
Yeah.
Can I encourage everybody, when you're out in the community talking to, not this include, well, it does include Jamie, but when we're out talking, the vaccine is safe. It went through the process like it's supposed to go through the process. I could kick somebody for calling it warp speed, but I didn't get to choose the name. And it's not going to change anybody's DNA. And don't laugh. I've had people ask me that.
oh, wow.
Going to cause, because of the mRNA, it's a legitimate question. So it won't change your DNA. It won't cause cancer, and the vaccine is safe. So just kind of start spreading the word, because we really need 90% uptake, and we usually only get 50.
My response to someone that, and this was probably not the most, my response to someone that was concerned about the vaccine was, I'm sure you've had worse in your body. Like it will be good in this pandemic.
Okay.
You won't have to wear a mask.
What
know
else do you mean, Amy?
We're not
That's good.
asking you-
That's a God, remember that. Somebody tells me something.
All
Did you
right.
say like that?
I think we're done for the, you know, we didn't make it, but it's 3:51, but I think we can quit. So I think we had a motion to adjourn. So everybody be safe. I guess we'll see you at the board meeting.
Be safe.
Hi, everyone.
Bye.